This is Dr. Gary dictating operative notes for a patient's family name, so and so, medical record number, so and so, date of surgery, so and so. Operative procedure is total abdominal hysterectomy with bilateral salpingio-oophorectomy. Pre-operative diagnosis, multiple myomas with menorrhagia. Post-operative diagnosis, the same. Surgeon, Dr. Gary. Assistant, Dr. So and so. Anesthesia is general anesthesia, Dr. So and so. Operative findings, an obese patient with bulky uterus with multiple uterine myomas, normal uterus, normal tube, and normal ovaries. Uh, there was normal exploration of the upper abdomen period. Incision is a midline incision period. Operative technique under adequate general anesthesia, supine position slash lithotomy position. It depends upon your patient. Patient was prepped and draped in the usually sterile manner. Follis catheter was inserted and left for straight drainage period. A midline incision was done through skin subcutaneous tissues down to the fascia. The fascia was incised, cut, the recti were separated, and the peritoneal cavity was entered and eventually period. Exploration showed the above findings. Period. The procedure started by application of self-retaining retractor. The, the bowel was packed away from the surgical field, and two Heine clamps were applied in the cornuas for retraction. The round ligaments were ligated using a ligature or using a zero vicryl. Retroperitoneal space was entered, and eventually the ureters were identified bilaterally, and the infundibulopelvic ligament was ligated, and zero vicryl was used for the ligature with a proper hemostasis period. A bladder flap was created, and the uterine artery was ligated and cut by using a zero vicryl. Multiple pedicles were taken down in the uterosacral ligaments and cardinal ligaments. All the ligaments were suture ligated by using a zero vicryl with a proper hemostasis period. At the level of the junction between cervix and vagina, two Heine clamps were applied, and the uterus was amputated along with the cervix period. The vault was closed by two Heine stitches using a zero vicryl as well as a figure of 8 in the middle with a proper hemostasis period. The hemostasis was checked and it was satisfactory. Irrigation was done, and the packs were removed. The count was correct times 2, and a drain was used, and the drain was fixed by using a silk zero period. At this point, the self-retaining retractor was removed and the abdominal wall was closed in layer, closing the fascia by mass closure or Smith-Jones closure, and a looped PTS was used. Number 1, subcutaneous fat was closed by 2O-vicryl, and the skin was closed by staples. Blood loss was 300 cc's. There was no complications. The urine was clear by the end of the procedure. The patient tolerated the procedure very well and transferred to recovery room in a stable condition. Pathology specimen was uterus, both tubes, cervix, and both ovaries. End of dictation, Dr. Gary Obigaini. Thank you.